My name's Chase Larson. I'm a dentist here at Total Care Dental, and I'm excited to share some of the things that we're doing here in the office that are unique, and show you kind of what's possible when it comes to your smile. It's a really exciting time in dentistry because the technology and the techniques and the materials have advanced to a point now where we really can not only make things last and make them strong, we can make them look really imperceptible and beautiful. So it's really a fun time to be a dentist, and all of our patients are lucky to be alive at this time when these things are available, because they haven't been up until fairly recently. So we're going to talk a little bit about what cosmetic dentistry is, but I want to talk also about the why. You know, why are we doing these things? Why do people spend the time and the effort and the expense to do this, and how does it benefit them? So again, like I said, if you have any questions, interrupt me, feel free, and we can kind of go wherever you want to go with this, and I'll just kind of provide some structure as we get started. So let me see if this will work here. Okay. So we're going to talk a lot about specifics about dentistry. So we'll talk about teeth, we'll talk about smiles, we'll talk about the kind of the nitty-gritty when it comes to cosmetic dentistry. But what are we talking about when we're talking about cosmetic dentistry? And I think what it really boils down to is all dentistry, I think, in my opinion, should be cosmetic dentistry. Whether that's a front tooth and that you see every time you smile, or whether it's a tooth all the way in the back of the mouth. And what I mean by that is it really should be invisible dentistry. That's what I consider cosmetic dentistry to be, is invisible dentistry. So when you see someone smile, when you look at somebody's teeth, you shouldn't see dentistry, you should just see teeth. You should just see a smile. So in order to get to that point, we really need to be able to mimic nature, mimic the contours and the shapes and the colors of natural teeth. And there's an ideal. We've looked at enough teeth over the last several hundred years to know what proportions are ideal, what shapes are ideal. And interestingly, when you look at studies, so researchers have taken studies of faces, and what they'll do is they'll have individuals look at pictures of faces, and when they take pictures of people and they actually form a composite image, so what they're doing is they're taking that image and they're kind of blending the two images together. The more people that they blend together, so basically the more average the face or the smile becomes, the more attractive it is to people looking at the face. So somebody will almost always in these studies, they'll look at a picture of a composite image, so multiple people's faces blended together, and they'll find that more attractive than the individual face. And so what that tells us is that there are these ideals and these averages when you look at enough people that we can use to guide us as we make decisions about how the smile should look, how teeth should look, because of those averages over time. So obviously there's individual characteristics to each person, and that's what makes teeth and smiles look natural. But there's also kind of an average and an ideal that we're looking for when it comes to cosmetic dentistry. And then the other thing is the way the teeth look is really only part of the equation. If teeth don't feel good and they don't function properly, then we haven't really done our job. So that's a really important part, and we'll talk a little bit more about that today. A really important part of what we're doing and what we're trying to accomplish. So there's really more to it than the teeth. We always talk about the teeth, we look at the teeth, we blow the teeth up on big screens and we scrutinize them, but it's really about more than just the teeth. So what is the point? And I want to talk a little bit about that. So I love this quote because there's so much that goes into a smile, and there's so many reasons that we smile. So this may be one. We smile when we're happy. We smile when we're embarrassed. We smile when we're nervous. We smile when we're in love. We smile when we flirt. We smile when we manipulate. Yeah, I guess you could say those are the same things, right? So we use a smile for all kinds of different things, but it conveys an infinite number of different meanings. And they're all very subtle and very different. When you look at a baby, right? So a baby's born, and the very first form of communication that we look for and we wait for is that smile, right? So babies actually smile in the womb, and it's not obviously a conscious thing, but it's those muscles begin to form that habit of smiling. And usually at about 6 weeks of age, we see that kind of for the first time, and it's really the first time when we feel like, oh, this is a human interaction. This is a human emotion being displayed that they're conscious of. And we do some pretty funny or weird things sometimes to get that smile to appear on a baby's face. I know I've done it. So a smile is really a form of communication. And studies show that that people that smile and tend to not hold back and have confidence in their smile tend to be happier over time. Researchers actually took yearbooks. So this was, I think, back in the 50s, and they looked at yearbooks of women, and they looked at their yearbook photos, and all they were looking for were whether or not they were smiling in the photo. So just a very basic a baseline test. And then they went and they looked 5 years later at these women, and they found that those that were smiling reported more of them were married and more of them were happy in their marriage. And then they looked 20 years later. And just by the fact that they were either smiling or not smiling in their yearbook photo had a huge correlation with whether or not the happiness or corresponded to their happiness and well-being years later. So there's a lot to a smile, both in forms of communication and then also how it affects ourselves when we smile and we feel confident about our ability to allow our emotions to come to the surface and not feel like we're holding back. So that's what I love about that quote. So let me just kind of illustrate kind of the why that I became involved in dentistry, specifically cosmetic dentistry, and the impact that it can have on people. So Stacy actually knows this girl. This girl lives in a little mountain village in Guatemala. So about 3 years ago now, I met her for the first time. At the time, she was 18 or 19. I can't remember. She told me, but I can't remember. I know she was almost 20, 18 or 19 years old. And I had gone down with a few other dentists and a group to do some dental work in this remote village up in the mountains. And we were working in a little hospital, and we had some people here from the United States that were helping us, and then we also recruited and brought some of the local village people to help kind of translate and coordinate. And in the mountains, most of the people don't speak Spanish. They speak a form of a Mayan language, Quechua Mayan. And this girl spoke Spanish and Quechua, and so she was helping us translate. And she was just the nicest girl. But I noticed every time you would communicate with her or talk with her, this is how she would smile. So she would kind of purse her lips, smile, but she wouldn't show her teeth at all. And so we had been there for about 3 days. We were wrapping up, and she came to one of the dentists, and she was really embarrassed about it. But she asked if we could look at her teeth and see if there's something that we could do. And she finally smiled for the first time and lifted up her lip, and she was missing her very front tooth right here in the front. So for an 18-year-old girl, you know, that's a significant challenge, obviously, to her self-esteem and her feeling of worth. And she was wondering if there's something that we could do for her. So one of the dentists that I was with had pioneered this technique where we can create essentially a bridge, an immediate bridge, without having to work with a laboratory and fabricate porcelain, where we can replace the tooth within a half an hour. And so we did that for her. We built a new front tooth, and she was obviously ecstatic, right? So it was fun, and it was fun to see her reaction, but I didn't think a whole lot about it. And then about a year ago, I went down to the same village, and we were working in the same hospital, and Stacy, one of my assistants, was with me. And as we're seeing different people, I saw her again, and she came up, and oh, sorry. But this was a really cool experience for me because in the time that had lapsed between the first time I saw her and we fixed her smile and gave her a reason to smile, she had gotten married and she had this new little baby, and you can see she's now smiling.
So how did you attach the tooth? Was there anything there to attach it to, or was it just her gums?
Well, she had teeth on either side, so we used those two teeth to anchor a tooth into place. So, you know, this is not something that's going to last 30 or 40 years for her, but for this really crucial period of time in her life, when that feeling of self-worth and meaning is important for her, it made all the difference.
That's cute.
So it's not about the teeth. When it comes to cosmetic dentistry, when it comes to the feelings of worth and confidence, it's really not about the teeth. And so I love this. This is actually a picture of my oldest daughter and my wife. But it's really about the feeling that is behind the smile, the reason that we're smiling, the emotion that we're showing behind the smile. And I like to think of a confident smile like a baby smile, right? There's zero fear. There's no insecurities. It's just that pure joy and that pure emotion coming forth. And I think that's possible for all of us, but for some of us, there are things that may be holding us back from kind of letting that out and allowing us to really smile or to show the emotion that we feel. So I actually borrowed this. This is a little video that I thought was really powerful. It's just a few seconds long, but it's really powerful. It's from a colleague of mine down in Arizona, Dr. Brian Harris, and it kind of illustrates the change that can happen in a person when they go from feeling self-conscious about really anything. In this case, we're talking about their smile, but it really can be anything where they're not feeling like they're able to really express themselves. So I thought this was kind of a fun little powerful illustration of that. So you can see the change really happen just almost overnight for this woman, where every time she smiled, she wouldn't show her teeth. And you can tell she's kind of holding back some of that emotion and some of the confidence that she wants to express. And then there's a change that happens. And it almost seems like she's happier, has more joy. Maybe not, but she now has confidence to really express herself. And Dr. Harris calls this a pivot point. So this is a really important point in someone's life, and in this case it happened to be her smile, but it doesn't have to be that, but it's something where we go from feeling insecure or feeling a lack of confidence to really being able to be our true self. So for some people it's their smile, and for other people it's something different. So let me just tell you a little bit about my background and my journey and some of the things that makes what we're doing here at Total Care Dental unique. So I went to dental school in Boston, Tufts University, and in dental school, this was the first kind of cosmetic dentist that I met. This is Dr. Ward. He was a dentist down in Rhode Island, and he only worked a half a day a week at the dental school. So he was in private practice pretty much full time, and he would come up essentially volunteering a half a day on Fridays and teach us in the clinic as students. And I got to know him, I started working with him, and he introduced me to an organization called the American Academy of Cosmetic Dentistry. And he invited me to come to the first meeting. And that was kind of the first experience that I had in cosmetic dentistry and using the techniques in aesthetic dentistry to do some of these kind of fun things. So after dental school, I moved to Idaho and I did a residency. So a residency is a one-year training program. And the residency program that I was in was really geared mostly towards surgery. It was a heavy focus on oral surgery, and the clinic director was an oral surgeon, and so we spent a lot of our time doing surgery. But I had the opportunity to do this. This was my first kind of cosmetic case, and you can see we basically rebuilt his whole bite, his whole mouth, redesigned his whole smile. And after doing this, I said, this is really what I want to do. This is meaningful both to me because I think it's fun and enjoyable, but it's life-changing for someone like this. So
That's good too. That was
Short.
first.
Yeah, it looks like it's so natural. I mean, except a lot of times you see people with, new veneers and
Right.
stuff, and they glare at you, and that's very natural.
right, yeah, and these are. Let me see if I can go back. Yeah, so in this case, a lot of the back teeth we replaced with implants here, and then these are all porcelain crowns to rebuild his bite, top and bottom. So after I finished residency, I started working in private practice, and I feel like it's kind of by luck that I got connected with a really well-respected dentist out of San Diego. His name is Dr. Hornbrook, David Hornbrook. And David Hornbrook's one of the premier cosmetic dentists in the country. And he was teaching a course that I attended where we go through the process of smile design and doing a case for a patient, and stayed connected with him and was working and studying with him. And then after a couple of years, he invited me to become part of his faculty. So here I'm with a couple of the other faculty members. There's about 6 of us that are dentists from all over the country. So one of the dentists is here in Provo, one is up in San Francisco area, dentist in Idaho, and then one in Atlanta, Georgia. And so every few months we come together and we teach cosmetic dentistry to dentists who do these cases and learn these cases for the first time. So I've had a great opportunity to learn and work with some of the best dentists in the country, refining and developing some of these techniques. And then I got connected with Dr. Jorgensen. So I've been working now with Dr. Jorgensen for about 4 years, and all of the stuff that I've been learning with some of these other dentists is pretty much traditional cosmetic dentistry. And Dr. Jorgensen introduced me for the first time to what we would consider holistic dentistry. And when it comes to cosmetic dentistry, it's really a cool blend of the two, where we can use natural materials, safe materials, but also a minimally invasive or non-invasive technique to obtain the same results. So it's really kind of fun. So that's something unique that we're doing here, is utilizing some of these holistic approaches to cosmetic dentistry, which has been really fun. So when it comes to cosmetic dentistry, I think this pretty much sums it up. You've all seen a smile where you're like, whoa, right? You've seen someone get veneers, or you see someone that has some dental work done, and it's not invisible, right? So I love this quote: if it looks wrong, it's wrong, right? And the follow-up to this: if it looks right, it might be right. So obviously this is wrong. When we look at this, they don't look like teeth. Nobody has teeth that came naturally like that, right? Mm-hmm. So what is cosmetic dentistry? So I'm going to go through a few things here and highlight a few of the things that we're doing that are unique and fun. So like I said, I consider cosmetic dentistry to be really invisible dentistry. It's dentistry that you don't even know they've had anything done. It blends in with the natural teeth, and it looks natural. I also think it's really important that whatever we're doing is as minimally invasive as possible, and also gives us the outcome that we want, right? So there's some give and take there. In order to get the aesthetic outcome that we need, sometimes we have to do a little bit more, or in order to build the function and the comfort into what we're doing, we may need to do a little bit more, but we should do it as minimally invasive as possible. everything that we do should be comfortable. So it doesn't do any good if things are beautiful, but the patient's in pain, things are hurting, we're making things worse. So it has to be comfortable. And one of the things that Dr. Jorgensen has really taught me is everything that we're using and everything that we're doing really needs to be healthy. So we're not doing our patients any benefit if they have a beautiful smile, but we're really affecting their overall systemic health by using materials or techniques that aren't healthy. And then there really has to be an emotional why. So this is really the thing that that makes us want to do this, right? There has to be a reason for the dentistry that we're doing, a why behind what we're doing. And I'll share a couple of examples of that. So let's talk a little bit about what invisible dentistry would be. So this is a case that we did a year or two ago. This is a patient that came in, and she actually has a pretty nice smile, but she hated the way a couple of her front teeth were darker than the others. So when you look at her smile, she has a nice full smile. She has nice shapes to her teeth, but there's a couple of teeth that are kind of dark. So when we talked with her, we found out her goal really was just to address those dark teeth. And instead of doing, a whole set of veneers, we decided, okay, well, let's just address the areas of her concern and blend it into her natural smile. And that's, when we talk about invisible dentistry, that's really our goal. So the first thing that we do whenever we do any case that involves aesthetics or the front teeth is we really look at where they are and where we want to go, and we design the new smile. And so we'll make some molds of the teeth, we'll take photographs, we'll make measurements, and then we'll design the new smile first in wax on a model. So here you can see this is her model, and with our ceramist that we work with, we've designed the shape of the new teeth in wax. And this is really kind of our blueprint for the case moving forward, and will allow us to try out this new design in the mouth so we can make sure that it's going to look good, it's going to feel good before we move forward with final veneers or crowns or whatever we're doing. So after we design the smile, the next step would be to actually put it into the mouth. So this is the same patient, and these are actually temporary. These are just the temporary veneers. So we just did these 4 front teeth, and even the temporaries you can see blend in pretty well with her smile. It gives us a good idea of how long the teeth should be, the color, the position, the shape, and all of that can be modified in this temporary stage. So these are essentially plastic over these teeth, and they can be lengthened, shortened, changed, adjusted, all of that. And then once we're happy with how they look, we'll go ahead and have the final veneers made. So this is what the veneers look like, the final veneers on the model. And you can see, I don't know how well you can see on these monitors, pretty well. So you can see that in order to make teeth blend in with natural teeth, there are all kinds of little nuances, little characteristics on the teeth here that natural teeth have, right? So there's different contours, the light reflects differently off certain areas. If they're too flat, they're going to look fake. If they're all one color, they won't look natural. So you'll see kind of towards the edge of the teeth, there's a little bit of change in color. The tooth is a little bit more see-through or translucent in this area. And there's little striations, little different areas of white and even some amber that natural teeth have that we're trying to mimic in the veneer. So using photographs, using the existing teeth as a reference, we then build the new teeth or the veneers.
Where does wax go? Like, how does it go from wax to this?
Good question. So what we do with the wax is we make a mold of the wax. Okay, so we have kind of a putty that we make, a mold of the wax, and then in the patient's mouth, we use that little putty mold, we fill it with a material that's liquid, and we put it in, and then it hardens in about 2 minutes. We peel the mold off, and it leaves that plastic temporary material over the teeth. So we trim that up, polish it, and then after we're happy with the shape, we'll make a mold of those temporaries, make a mold of the mouth, and then use that mold as a guide for the veneers. So the ceramist will then use that mold to create the shape for the final veneers, and then use the photographs for the color and all the little characteristics that he builds in. So the ceramist that we work with, his name's Clint Bigelow. I mean, these guys are true artists, right? So what they're doing is they're basically taking a piece of porcelain and then using powder and liquid and tints and different colors, and they're creating these three-dimensional teeth with all of these different colors and different styles of porcelain. So this is you can see this is her final smile. This was the day we inserted the veneers, and you can see that just by doing those front four, they pretty well blend in with her natural teeth really well. So instead of doing all of her teeth, we were able to just do these front four. And you know, if you saw her and were talking with her, you really wouldn't have any idea that these were porcelain, right? They blend in really well with her natural teeth. So one of the unique things that we're doing here in our practice is minimally or non-invasive veneers, porcelain veneers. And this technique was not available even probably a decade ago. So there were some attempts to do non-invasive veneers, but they aesthetically were not good. They were really opaque and really bulky. And so this new technique's been developed where we can create very, very thin layers of porcelain and place them over teeth. And a lot of times we don't even have to touch the teeth underneath. And that's a concern for a lot of people. I mean, a lot of people are interested in a beautiful smile, but one of the things that's holding them back is they don't want their teeth to be ground down, right? So we hear that a lot. But this technique allows us to get the results that are just as good as the traditional technique without grinding down the teeth.
So I have a question.
Yeah.
So your teeth all have breeze, so to speak, right? I mean, you know what I'm saying?
Tubules.
Yeah. So when you put something over them, how does that affect the teeth underneath?
Good question. So ideally, when we're restoring teeth like this, we're not removing all of the enamel of the tooth. So we're trying as much as possible to leave the enamel intact and just bonding to the surface of the enamel. So in some cases, if the tooth already has an existing crown, or the tooth's pretty broken down, whether due to decay or it's really worn down, we may need to cover more of the surface of the tooth. But the goal is to essentially protect as much of the natural tooth as possible, because the best thing a tooth can be made out of is tooth. So in this case, I'll show you this case where essentially we're not removing any tooth at all. We're just bonding to the front surface of the tooth using a very, very thin layer of porcelain. And so it's technically a reversible procedure. I mean, if we wanted to just take the veneer off, we could, and polish the teeth back up to their natural state. So in that case, there's the tooth itself is not damaged in any way. So this is an awesome patient. This is Mackenzie. And Mackenzie had been through how many sets of braces and surgeries and.
Well, she had braces when she was a kid, and I don't know what went wrong with those. But then she had a deviated septum, so she'd been a mouth breather for her whole life. This is my niece, so I know. And so then she had to have surgery on her nose, and then her jaw was growing crooked, and so then she had to have a part of her jaw shaved off and her jaw wired shut and everything. And through it all, her teeth got spaces in them, even though she had worn braces.
So she'd been through the ringer,
Yeah.
right? She'd had years of treatment, very invasive surgeries to correct the jaw position. And this was the day she got her braces off. So she came to see me an hour after she had her braces removed. And what we did here was, her teeth are very long and narrow. And so we had the orthodontist space the teeth so that we could basically fill the spaces and add to the size of the teeth and make them proportional without having to remove any natural tooth structure. So she came to see us the day she got her braces off. And you can see here, she has pretty teeth and a pretty smile, but she didn't like how tall and narrow the teeth were, and she didn't like the spaces between her teeth. So she obviously didn't want to have the spaces, because with the braces, they weren't really noticeable. And now that the braces were off, she didn't want to have those spaces. So what we did is that day we used a little filling material to fill in those spaces and give her an idea of what it would look like if we were to do something to fill in the spaces between the teeth. So this is how she left the day after.
Did you make the front teeth wider? So
We did. So we basically just added a little filling material to each of the front teeth to broaden those and widen those a little bit. So she left that day. So when we talk about non-invasive, this is how her teeth looked right before the veneers are bonded into place. So essentially we didn't remove any of her natural tooth. All we did was basically polish to remove any surface stains, to remove any plaque, to make sure things were smooth. We just polished the teeth really well, made molds of the teeth, and then these are the veneers that were fabricated. So they're very, very thin, and in this state, they're very fragile. So working with them can be a challenge. There aren't very many technicians or ceramists in the United States that even like to do these because they're very difficult to work with.
They're like as thin as a fingernail.
Yeah, I mean, even thinner.
Even thinner?
Mm-hmm. So
Depends on the
you drop them, game over. You got to restart and remake it. You pinch it too hard, it breaks. So they're very thin, but once they're bonded into place and they're reinforced with the cement, they become as strong as natural tooth.
And they don't cover the entire, the back, like the back side is not covered.
No, so they'll basically, you go in between the teeth because we had some spaces there. If we didn't have spaces, they would just end right at the joint between the next tooth. And in this case, we lengthened just a little bit, so they did wrap around the edge, but we didn't have to remove any of that natural tooth. So let me just show you the kind of the process of bonding these into place, and you can see what it looks like. So this is actually a different patient, but the same situation. So we clean the teeth. Let me turn that down a little bit. You can see those bonded into place with the cement very carefully.
Whoa.
So this is the final result. This is immediately after they're cemented into place. And I would love Mackenzie to come back so I can get some new pictures.
She
But
would have come for sure. She just happens to be.
she's having too much fun.
She was like went on a cruise.
Wow.
So this is immediately after they're cemented into place, right? And you can see the proportions are a lot better. We widened the teeth a little bit. We filled in the spaces, and then Mackenzie wanted to do a little bit of bleaching, so we used a little bit lighter color here in the front, and then she was going to bleach these back teeth now that the braces were off in order to match. So the cool thing is we can get really lifelike, invisible results using techniques that are non-invasive, which is pretty fun. And then you can see this is her smile right after we
She's
finish.
a cute girl.
She's super cute. So the other important thing we talk about is anything that we're doing should be as comfortable as it was when we started, or it should improve. And what a lot of people don't realize is the things that we're doing when we talk about cosmetic dentistry or aesthetic dentistry, a lot of times improve the way people feel. So headaches, jaw pain, tooth pain, a lot of it is related to the way our bite is created or is positioned and how the teeth work together with each other. So let me show you this patient. This is Natalie. Natalie's one of my favorite patients. And Natalie is another one that's kind of been through the ringer. I don't know how many years Natalie has been in different forms of treatment, but she's had braces multiple times. She's had different jaw treatments multiple times, appliances for several years. She's had different surgeries, and a lot of it is because she's had jaw pain. Her jaw doesn't feel comfortable. Things hurt. She's had some airway issues, so she wasn't able to breathe very well through her nose. And so she went through a lot of treatment, and a lot of it was good. It just took time. It took a lot of time. And a couple of months ago, I saw Natalie, and we were getting an update on kind of where she was. And she said that she had visited with another doctor, and she was told she needed another round of braces and another appliance for several years, and it was just too much, right? She said, I'm not doing that. I've had it. I'm done with it. And so she asked what we could do to try to get her more comfortable. So one of the big challenges, she has a nice smile, right? She has pretty teeth. She has a really pretty shape to her smile. You can tell she's had braces because everything's in the right position. And so for her, the way things looked was secondary to how things should feel. She really wanted to feel better, and as a bonus, make things ideal. So what we did was we started with an appliance. This is called an Anterior Deprogrammer. And this is a diagnostic appliance. It's like a little clear retainer that we put on over the teeth, and it has a little platform in the front. And what it does is it essentially allows the jaw to go to the position where it's most comfortable, and it takes the teeth out of the equation. So so when you bite together, the jaw joint should be fully seated up here at the base of the skull at the same time that all of your teeth come together with about the same amount of pressure. The force is distributed evenly, the muscles are relaxed, everything's comfortable. But a lot of times, for a lot of us, when we bite down, the way the teeth are positioned, they force our jaw into a unnatural or a position that's not relaxed. So the joint's not fully seated, the muscles are stretched, and that creates more force on the teeth, and it can create jaw pain, it can create muscle pain, it can create headaches. And that's what was happening with Natalie, is that her teeth were pushing her jaw into a position that was not comfortable. And so the muscles were fatigued, her jaw joint was hurting. So what the deprogrammer does, and we use this a lot, is it kind of takes the teeth out of the equation. It allows that jaw to go where the muscles want it to go, where it's comfortable, where it's seated here. And then we can design the new smile and the new bite in that position where things are comfortable. So she wore this for a couple of weeks. She came back in, we made a record of where her jaw was positioned most comfortably, and then we designed her new smile in that position. And I actually just saw Natalie today. We just took these pictures today. These are her temporary veneers. And we used the veneers, we did all of her upper teeth in order to recreate the bite position that was most comfortable for her. So you can see, she had a pretty smile before, but we idealized things here. We made the colors all the same. But most importantly for her, she said today, I don't know how long it's been, how many years it's been, but she said for the first time in the last 3 days, so we just put the temporaries on Tuesday. She said for the last 3 days, she's finally been able to relax her face and her head because she's not fighting against her teeth to try to get her jaw in the right position. She can just relax and it goes right to where it needs to go. So this is a really important part of what we're doing. And you can see this was her earlier today with her temporary veneers. So really important that things they're comfortable. Yeah, she's awesome. So the other thing I want to talk about is health. What we're doing, how is that affecting the overall health and our systemic health? What are the materials that we're using, the techniques that we're using? Traditionally, dentistry used a lot of metal. So really was the only thing that was strong enough to survive the forces in the mouth. I mean, the mouth is a really harsh environment. It's always wet. It's very acidic. There's incredible amount of forces that are happening all day, every day. There's bacteria. So it's been a long time in coming and creating materials that can withstand all of those things, that can look good for a long time and that don't break. And so for a lot of years, metal was really the only option. Gold was used for a long time. People got to the point where they didn't really like the way the gold looked, So then we would basically still use gold and then cover it with a thin layer of porcelain. So we still had some strength, but we also now had it look kind of like a tooth. There's some downsides to metals. The way they react in the body, the way the tissue around the teeth and in your mouth reacts to the metals is not ideal. So we need to make sure that whatever we're using in the mouth is healthy. So this is another one of my favorite patients. This is Anne. And Anne's just the sweetest lady, but she was concerned about all of the stuff that was in her mouth that she had accumulated over the years, decades worth of dentistry that was kind of starting to break down, and she was concerned about how it was affecting her overall health. So I'll show this picture. This is a picture, this is her smile before, but this is a picture that kind of shows how things looked when we first saw her. So you can see a lot of these existing teeth. You see this dark line. These are all teeth that have metal crowns. So she has a bunch of different surfaces of metal here. She has an implant here that has some infection. And I mean, when you look at this, it just doesn't look healthy, right? So her biggest concern was getting healthy. And again, as a benefit, you know, improving the way the smile looked. So same thing here. We used a deprogrammer. We found where the bite position would be most comfortable for her. And then we designed her new smile. And so we took all of the old metal out, all of the old dentistry. And you can see these are her temporary crowns. So we did all of her upper and lower teeth. These are her temporary crowns. We took this implant out. We made a bridge. So this is actually a tooth that's suspended between these other two teeth. But it just looks cleaner and healthier. And we're reducing that toxic load and that toxic burden on the body from infection, from the materials that don't respond, that the tissue doesn't respond well to, and things can just settle down and the level of inflammation in the body is decreased significantly. And then these are her final restorations here. So again, the goal is we want it to look natural and be invisible, but we want it to be healthy and comfortable as well. So there you can see her after we finished. Just a nice lady.
Loves them too.
Yeah. So, and then lastly, I just want to talk about the why. So again, like I said, it's not about the teeth. The things that we're doing, yeah, they look beautiful. And as a dentist, I love the little nuances. I love the teeth part, right? I love looking at the shapes and the contours and the proportions and the color and the texture, all of that. But people don't care about that, right? They don't care about the individual teeth. They care about the why behind what we're doing. So I just want to share this last example. This is a patient. Her name's Liana, and she was just getting ready for her wedding. And for her, you know, we talk about confidence and we talk about being able to be your true self and not hold back. For her, she felt like her smile was one thing that was not allowing her to do that. And so, I mean, she has a pretty nice smile. There's nothing really significant about her smile that stands out, right? Nothing that you would say she should be self-conscious about. But she didn't like how narrow her smile was. She felt like you only saw her front 6 teeth. Her other teeth were kind of hiding. She didn't like how the teeth were a little bit crooked in different lengths and different positions. And so she was wondering what we could do to help her. So again, this is just a close-up view of that same smile. You can see these teeth are kind of hiding in the back. These front 6 teeth are really prominent. She didn't like the little chip edges on her teeth. And she didn't like how the color was just a little bit different on certain areas. So in every case, whenever we're redesigning a smile, the first thing that we'll do is we'll talk with the patient, figure out what are your goals? What are you looking for? What are the things that, you know, if you had a magic wand, you could change about your smile in order to get the results that you want. And then using the kind of the averages that we talked about in the beginning and the proportions that we know are aesthetically pleasing and the ideals that we see in the general population, we'll create a blueprint for her individualized smile. So we do this with every case. We'll take the photographs of the case, and then I'll provide instructions to my ceramic team on how we want to design the new smile. So in this case, we were going to bring these back teeth out a little bit. we were going to reshape. You can see where these red lines are. We're going to reshape the gum tissue, and we're going to lengthen the teeth a little bit and straighten up those chipped edges. So we give that information to the ceramist, and then you can see they'll create a wax design based on that design that we gave them. So here you can see the wax design on the model. This was the question that Laura had, what happens to the wax? We then transfer this design directly into the mouth. So you can see that these are the temporary veneers. These are exactly the same shape as this wax design. We use that mold, transfer it into the mouth, and then we can basically test drive the new smile. So this is a really important part of the process. We want to make sure, again, that the smile is comfortable, that the patient can talk with the new teeth, that they don't have any speech issues. Sometimes if the teeth are in the wrong position, it's hard to say our S sounds properly. We'll create a lisp or create our F sounds. So wherever this front tooth is positioned in relation to the lower lip and in relation to the other teeth and the tongue makes a big difference in how we speak. So if those teeth are in the wrong position, we have to modify them so that you can speak properly without a lisp or not being able to say certain sounds. So we'll test drive the new veneers, make sure that we like the way they look, but also that we can talk with them, we can eat with them, we feel good with them in our mouth. And then we'll create the final veneers. So these are the final veneers, and you can see she wanted a nice bright smile, but also something that looked really natural. So we created a lot of these natural effects here in the teeth. You can see the teeth are a little bit longer. These back teeth we brought out a little bit. That was one of the things that she wanted. It was a little bit broader smile. She felt a lot more confident going into the biggest day of her life to that point, right? She felt like she could smile confidently without holding back. And so that's why we do what we do. You know, it's fun to work on teeth and it's fun to be artistic, but to help patients pivot make that change in their lives where they feel like they're not self-conscious or they're not able to fully express themselves, and now they can, is a really fun thing that we get to do. And it's a fun I guess it's, what am I trying to say? To really love your job and to feel like you're making a difference in people's lives it's really fun. So yeah, I was just gonna say, if you have any questions, go ahead.
Do they last a lifetime?
Like I said, the mouth is a really harsh environment, right? So every time you chew, your teeth are experiencing really excessive force. There's bacteria in the mouth. It's very acidic. It's always moist and wet. And so over time, things will break down. We tell patients to expect veneers or crowns to last 15, sometimes 20 years. So a lifetime, I guess it depends on how old you are, right? Or how long you're going to live.
Mine are gonna last 30,
30?
because then I'll be 90. And
I'm done with it.
yeah, I pretty much.
I don't
I don't think I'm gonna care about what I
So
look
that
like.
means mine need to last 40.
40?
Yeah.
Well, the good news is the way you take care of them can make a big difference in how long they last.
So can you bite like into an apple? Or,
Yeah.
I mean,
Yeah, so you should be able to use your teeth to do anything you should use your natural teeth for.
Yeah.
So biting into food is good, you know, apples, carrots, jerky, things like that. But using your teeth as tools, so whatever I would avoid with natural teeth, opening bags. My mom's is sewing thread. She chips the same spot every time, sewing thread. My dad's is fishing line.
Really?
So, yeah. So avoiding using those things, opening cans, biting fingernails.
Opening cans with your
Wow,
teeth?
that's kind of a talent.
Are you Popeye?
Like a, not like a, I'm talking like a soda can or something.
Oh,
Oh,
Yeah.
I'm thinking a can opener.
No.
So do you use the deprogrammer
beaver.
with every patient, or if it depends on the case, on how many?
Depends on the case. So if things feel good when we're starting and the bite is in a pretty good position and we're not changing the bite, we're just reshaping the teeth or changing the way things look, then we typically won't use a deprogrammer.
What if they need some kind of ortho on their bite?
So
That first
So what we'll typically do is start with the deprogrammer. So if we're worried about the bite, if we're going to change the bite, or things aren't comfortable, if the jaw is not comfortable, or there's pain in the muscles, the teeth aren't comfortable, we'll start with the deprogrammer and we'll find out where the jaw is most comfortable, where that position is, and then we decide, okay, how do we get to the end goal? Can we do this just by rebuilding or reshaping the teeth, or is it going to be better for us to move the teeth into a position that is better? And it's really a decision that we make together with the patient. So, you know, if our goal is to be non-invasive or as minimally invasive as possible, it may be a better option to move the teeth, and then we have to do less preparing or less removing of natural tooth structure. But in some cases, we can get there just with the porcelain. We can recreate the bite in that position. So it really depends on the case, it's case by case. But we really start with, okay, where do we want to go? And then how do we get there? Porcelain, braces, both. Sometimes just some reshaping of the teeth without even doing any other work can get us there as well. Any other questions?
What do you do to make, sometimes you make their gums lifted or something. What do you do? How do you make that happen? With the laser?
So the laser is one technique. Depends on how much tissue we're removing, and it depends on the state of the tissue before we start. So if we're just making minor modifications to the gums and there is enough gum tissue there already, we can just use a little, it's called the Diode Laser. It's very simple. Patients don't even know that we've, obviously we talked to them about it beforehand, but there's no discomfort afterwards. You really can't even see that it's been done other than the tissue. We bring the tissue up a little bit. If there's not enough gum tissue, or there's, we have to remove more tissue than we would with the laser, sometimes we'll have to do a procedure called crown lengthening, and this is a surgical procedure where we'll actually kind of lift the gums up, reshape the bone underneath, and then put the gums back in the correct position. That we can do a lot more modification that way, but then we need to make sure that the tissue heals for a period of time before we move forward so that everything's in the ideal position and everything's stable.
I'm starting to understand why you go to school for so long to be a dentist. This is a lot. This is just one aspect of it.
Yep.
How long? 6 years?
For school?
To be a dentist?
Well, 4 years of college, 4 years of dental school, and then any postgraduate residency training. So depends on what you kind of where you go, what path you go in. So
But you always go to classes, don't you?
we spend a lot of time learning, and yeah, several hundred hours a year learning. I mean, things change so quickly. Even since the time I finished school, things have changed really, really quickly. And so we spend a lot of time staying up with the state-of-the-art materials, state-of-the-art techniques, and refining the things that we're doing. Because if there's a better way to do it, a less invasive way to do it, a way to get better results, something that lasts longer, we're always looking for things to last as long as possible. We're looking for those things and adapting. So thank you. Good.
I do have another question. So does it get tartar on it like a regular teeth do? Or, I mean,
The porcelain?
Yeah.
It can, but less so.
They
So,
don't stain like regular teeth.
right. So there's different materials that we can use for different applications. So one of the materials, and the material that we showed mostly today, is porcelain. So porcelain's very stain resistant. It's also pretty resistant to tartar. So you're not going to see as much tartar or buildup on porcelain as you would with natural teeth. One of the other materials that we use sometimes is composite. Composite is what white fillings are made out of, and we can use composite and shape it on the front teeth in order to create new shapes, colors, things like that. And composite's a little bit more susceptible to staining over time. So if somebody has composite restorations or composite veneers in the front, they may need to be polished a little bit more frequently or touched up and modified than the porcelain would be. But yeah, they're pretty resistant to stain. But it's also important to maintain them properly. So if you've had veneers done or you've had restorations done in the front, there are things that I would avoid. I would avoid anything really abrasive, like abrasive toothpaste. So when you look at different toothpaste at the store, typically your whitening toothpastes are very abrasive. They're designed to remove surface stains from coffee and tea and dark beverages, things like that. They're almost like it's almost like sandpaper, gritty sandpaper. And so they'll tend to dull the porcelain a lot quicker than a less abrasive toothpaste. So there are things that you can do to kind of get them as much time as possible out of them. But okay, well, thank you for coming. I really